The surviving sepsis campaign addresses this issue, and they says that initially the antibiotics should be started. It should be given in the first hour because the patient may get benefited from it. But later on, if the evidence is going against the secondary bacterial infection, suppose if all the blood cultures, the urine cultures are negative, the procalcitonin level is speaking against the bacterial infection, then it can be down titrated. It can be started later on. But initially, the patient should not be deprived of.
Okay. And why, Dr. Dopamine should be avoided as a vasopressor in cardiogenic shock?
Because the studies previously and the guidelines recommend that the dopamine is not having any mortality benefit. Dopamine is actually having two effects. One is the effect on the heart. The second one is on the peripheral vessels. And the dose is usually different. If we utilize the renal dose, that is up to 5 microgram per kg per minute. But if we want to utilize the cardiac dose, that is from 5 microgram to 10 microgram. And the dose in septic shock is much higher, that is up from 10 to 20 microgram per kg. So it becomes quite difficult to tailor which dose we should give, which should we not give. And that tailoring may cause some mismanagement. And that's why the dopamine previously studied does not have any mortality benefit. The norepinephrine has much higher mortality benefit, and as an add-on therapy, vasopressin or the butamine has a mortality benefit, so that should be considered first.
Thank you. And before we just leave to Dr. Doshadram, there is one very important question. Has there been association between smoking and exacerbation of COVID symptoms, especially that smoking and cytokines release syndrome were co-linked? If you have anything related to these things or this issue, can you just give us any details about it?
Well, I didn't. I didn't see it, so I'll try to go back to the literature and search it, and will inshallah upload or update you in the Sure platform. At the moment, la adri.
Sure. Okay, sure. Thank you very much, Dr. Muhammad Shabir. And now, which is the psychological issue during the pandemic, start to appear more, and some is suffering from fear, and others become panic. Dr. Doshadram, he's assistant professor of psychiatry, has something to say about psychological crisis and anxiety associated with COVID-19. So I would like just to welcome Dr. Doshadram to give a speech about that.
Thank you, sir. In the first, I will thank Sakra University for giving me this opportunity, my dean, my vice dean, and the man behind the scene, Dr. Moaz, for giving me this opportunity. I will be a little brief because here the fluctuation of internet connection is there, but I will try to finish as soon as possible. So I will be presenting psychological crisis and anxiety in COVID-19 pandemic. So I will present in the following order: need of good mental health, effect on day-to-day life, effect on healthcare workers, psychological impact, what after the test become positive, what are the clinical interventions available, what is the impact of isolation, how to deal with self-isolation, what are the role of healthcare workers, and what is WHO message, and some tips for it. So what is the need for good mental health? First of all, we should know what mental health is. Mental health is a state of well-being. It is a state of well-being in which an individual realizes his or her own abilities and cope with normal stress of life and can work productively and is able to make a condition able to make a contribution to his or her community. So this is a mental health. So what is the relation between infection and mental health? I will say viral infection and mental health, particularly COVID-19. There is a reciprocal relationship between infection and mental health. If infection is there, mental health deteriorates, and if mental health deteriorate, infection chances is there. Poor mental health support suppress the immune system through cellular and endocrinal system. A good mental health optimize the healing and recovery from infection. Poor mental health predisposed to any infection, particularly viral infection. And certain disorders such as substance use disorder, particularly smoking, is important for COVID-19 infection because it directly affects the respiratory system. So why good mental health is important to us at this moment to know is, if you know, the COVID-19 pandemic has created a panic across the world. And this pandemic is actually resulting in poor mental health. And this poor mental health leads to poor immune system that leads to severe infection and poor outcome from the illness. So something about issue of patients with mental illness who are currently suffering from mental illness. What are the issues they are facing? Mental health disorder can increase the risk of infection, as I already told, but it is particularly for pneumonia. Many research has shown that those for anxiety disorder, for those with depression, those with other psychiatric disorder, they are prone to develop pneumonia due to any cause, particularly any respiratory causes. Once they are infected with COVID-19, they face more barriers in accessing timely health service and more likely to have poor outcome. There is a high risk of relapse or worsening of already existing mental health condition. And because of lockdown, there is lack of loss of followers and travel restriction that may worsen their condition. So what is the effect of COVID-19 on our day-to-day life? So if you see, this is a unique time. It comes rarely about it. People are doing a lot of research, but we don't know. This time is very critical. Different people are facing different.
Dr. Doushad, I think there is slow connection and your voices cannot be heard. So can you be with us now? Do you hear me? If you can hear me, just type that.
Common person are forced to stay at home. There is plenty of time. How to manage it, they don't know.